audio sounds okay with this. I think it will. I think if I put it, oh, I wanted to put it under here, but I think I'm gonna do it backwards. Go here. Hopefully it doesn't hit the train. Hopefully you guys can hear me okay. Because this one, I'm gonna do about 15 minutes on the Peloton and then do a 25, I guess it's usually about 27 minutes total body workout using one of my favorite workouts is the Shanti bodybuilding workout. So kind of hit a little bit of everything, upper body, lower body, abs, and everything that we do. The most important thing is always consistency. American Heart Association recommends 150 minutes of moderate intensity activity each and every week. And then sometimes that means that it's 30 minutes a day or 50 minutes a day, anywhere from 3 to 5 days a week. But most important thing is consistency. So if you can only allocate 10 to 15 to 20 minutes, do that, but be consistent with it. Watch what you're eating. Look at how much salt you're taking in. Look at just how much calories you're taking in, and look at your metabolism. If you notice that you burn calories easily or burn fat easily, then then congratulations. But if you notice that sometimes it takes you a while to be able to burn the same amount of calories as other people, then you got to understand that with that you're gonna have to. I don't really want to do Tabata. I'm not ready for that. I want 15 minutes, but I don't want to climb either. I guess I can do a soul ride. Also, if you guys are logging on, if you guys can hear me, let me know just to make sure that this audio sounds okay. My name is Dr. Hussein, cardiologist, using this platform to be able to discuss things regarding your heart health and prevention, but also using my lives to just show that, simple things like just get on your exercise bike is all what you need. If you don't have an exercise bike, that's okay. Go out and walk. I have a small home gym here, so I'm able to utilize that on a consistent basis, and usually I try to utilize it anywhere from 2 to 4 times a week. If I could have it my way, I would want to use this exercise bike 7 days a week, but I know that perfection is not is the worst thing that you can ever strive for. So what I strive for more is consistency. I'm about to go to Atlanta tomorrow, so I'm trying to get a workout today, tomorrow, and then when I come back, I'm gonna hit up 2 or 3 more workouts. So consistency is key. It's about to start in 5 seconds. Y'all wish me luck. So I'm gonna do this for 15 minutes, and then I'm gonna do a free weight workout utilizing my boy Shanti. What's going on, everybody who's coming in? Hope you guys are doing well. Turn up. If you guys, find content regarding your heart health and prevention, that is all what I usually try to post, especially my longer videos, which I'll be making more of. Leave it in the comments what you want to know more about when it comes to your heart, when it comes to your health. I talk about things like high blood pressure, hypertension, coronary disease, heart disease, chest pain, irregular heart rhythms, palpitations. But if you want to know anything else in the heart health prevention type of realm, let me know. One of the things I'm digging more into also is also in the prevention aspect, but also looking at, natural ways. When people come and see me, it's the disease has already happened. Now we got to look at ways that we can prevent it, which utilizes medication. But can we use other things too? For instance, for pain, NSAIDs is good. Aspirin, ibuprofen, not aspirin. Ibuprofen is good, but it can also hurt the kidneys. So are there natural things that we can use for pain that can help with inflammation? I've heard about turmeric and I didn't use it as much, but I've been having really bad plantar fasciitis, and turmeric has basically helped me get over it. So I'm finding more and more things. Beets I've been a fan of. You know, vitamin D is a huge one because we're all deficient. But let's get into it. Leave any questions you guys want, but I'm about to get into it a little bit. Also, if you're hearing me, let me know too. For those of you guys who's popping in, let me know where you're coming from. Make me feel this way. Oh. It's hard to talk and do this at the same time, but I appreciate it. Is it Sydney? Sydney, thank you. That's the fastest we go. Turn up. So, like I said, 150 minutes every week. But more importantly, consistency. I find that a lot of my patients start to incorporate exercise into their regimen after something has happened. After they had a heart attack or a stroke, diagnosed with kidney disease. If we start now, we can hopefully delay or prevent it. And that's all what we want, is to be able to live life how we want to. I have a lot of patients who are in their 70s, 80s, 90s, and they're all functioning really, really well. And they all have something in common there. They remain active their whole life. Let's see what it looks like. Adding a little bit of lighting. That lighting better? Let me know if the lighting is better or worse with that. Looks mad bright. I think it's good for me to do a workout like this where I can still talk. And then, oof. So with heart disease, it is the leading cause of death in the United States of America. Risk factors include things like high blood pressure or hypertension, high cholesterol or hyperlipidemia, diabetes, strong family history, smoking. And I think one of the biggest ones is just not seeing a primary medical provider on a routinely basis at least once a year. And if you can do it maybe more than once a year, if you need things to be looked up for. A lot of times people are having these chronic diseases that are not being cared for. And then by the time it shows its face, it's a heart attack, it's a stroke, it's dementia. A lot of times dementia comes unnoticed, but people have had small strokes, mini strokes for a long period of time that led to the dementia. So it's important to look at those risk factors so that you can treat them down and hopefully live to your 80s, live to your 90s without any issues. If anybody is still on, you guys can hear me, just leave a number 1. That's all I need to know, is that that the audio is working okay. And the audio sounds okay. Just leave a number 1 or just send me a message that audio is good. All I need is just somebody to just say I can hear you. Come on. It's not gonna hurt. You can even write it and then delete it so I can just make sure that people can hear me. Those of you guys who just logged on, if you guys can hear me okay, leave a message, leave a number 1 so I can know that I'm not talking to myself. Maybe the reason that no one is writing anything is because they can't hear me. Well, that'd be embarrassing. Well, I'm not sure if people can hear me with this. I'm just gonna take it off. If y'all could and y'all didn't say anything, that's messed up. Yo, what's going on? If y'all can hear me now, let me know. I was asking if people can hear me. They didn't say anything, so hopefully you guys can hear me now. Something as simple as just riding your bicycle, if you do have one, or walking up a flight upstairs several times. There's so many ways that you can remain active without having to have an expensive setup. Of course, this is expensive, but you can find exercise bikes for under $300. Heck, on the marketplace, you can find really good ones for even cheaper. If you're looking for a bike, something like a Schwinn would be really good. If you guys can hear me, let me know, so I'll make sure I'm not talking to myself. This is Dr. Eastley once again, exercising, showing you guys. I don't just say this for no reason. It's about to get a little bit on the hard side, so you guys don't mind me if I struggle a little bit. Papa was a rose. Y'all can hear me, let me know who just popped in. Let me know where y'all popping in from. Let me know what you guys do for exercise. Ooh, okay. It was starting to burn. That was disgusting. Hopefully no one saw that. Well, I asked if people can hear me now. They don't say anything. When I had my mic on, they didn't say anything. I'm not sure if people can hear me or not, but that's all right, though. When I first got this Peloton bike, it used to be very painful on my behind. They say if you keep doing it, you're gonna get used to it. I ended up getting 3 more seats. My third one is the most comfortable. It's a little bit off to the side, but it's all right. Hope y'all doing okay. It's about to be Christmas. I hope Santa Claus came and visited you guys. He visited us last night, and just the expression on my kid's face was priceless. Especially my daughter. Oh my goodness. I'm going to cherish that for the rest of my life. My goodness. Thankfully, I was able to record it, so she'll be able to see it again. Ready? Second and final acceleration from 94 to 100, 105. Your best. We go in 5 and 4, 3, 2, pick it up, let's go. 20 seconds here, that's it. 8 more to go. Here we go. You have 8, 7, 6, 5, 4, 3, 2, 1. Pull it back to 94. I got a minute left on this. And then it's supposed to come to workout. But I don't have my workout. I don't have my... I gotta go get it. If not, they're already 25 to 35. Take your cadence anywhere 70 to 80. This is where you started. Find yourself back there. If you haven't heard the original Cruise and Smokey Robinson, and you thought this was a D'Angelo, you're welcome right here. Pretty Ricky's what they called him. So cute, David. Two, one. It's not a one-night stand. It's not a one-night ride. So your legs seat down. You can stay right here. This song has been for like 4 minutes. You can take this into your own cool down. One hand off the bike, other hand off the bike. Show yourself and your fellow bosses some love. All right, I gotta go. If y'all can hear me, let me know in the comments. I'm about to go get my iPad so I can do my other workout. So y'all give me a second. It's gonna take me about maybe 40 seconds to an hour. Turn on the lights. Turn on the lights. There you are. Alright, got the iPad. Come in. Now when you guys see me walking in, you're gonna see an interesting gait. It's cause I have foot drop on the leg on the side that has my iPad, so I can't pick up my ankle. So I wear a leg brace, so when I don't wear a leg brace, that's what it looks like. It looks pretty bad. It looks embarrassing, but I don't care anymore. First things first, I want to see if you guys can hear me, so I'm gonna do something real quick just to make sure that y'all can hear me and are just choosing not to make any comments, so I can make sure that I'm not talking to myself. And there it is. All right, so y'all be tripping. Y'all can't hear me. All right, so next I'm gonna start with how long I've been going? I've been going for about 20. That was the first 15 minutes. So now I'm gonna do the total body workout. All right. I know what to expect, so just getting everything set up. And give me some 35s. This is probably one of my favorite workouts because it's so simple. Some 25s. I'm not sure if I used 25s in the past, but we're gonna use it now. Some 20s. And then I'm gonna get some 15s. Thankfully, I've already pretty much done a warm up, so I don't need to get that stretch like I did before. I could probably use 30s. I mean, I could probably use 40s, but I'm gonna use 40s. I can probably use 40s, but I'm gonna use 35s. Oh. Not sure what. I think everything is 12 reps. Oh. Hopefully nobody saw that. It's one of my favorite back workouts too, just because I just like the way it feels. Last one. 12. I'm gonna get 15s for this one. I really should do 12s. Only because I feel like whenever I do my lateral raises, less weight, more range of motion, better workout. But I have 15s here, so I'm gonna get it. 4, 5, 6, 7, 10. That's 1, 12. Ooh. I think I'm going to use it 12 for the next one. And then I'm going to go back to 15s because I feel like 15s but not going as high is also just as good. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Last one, best one. 12. Turn up. Because I finished early, I can get these 12s. I think the next workout is a ab workout. Usually the first couple ones hurt a lot, but if I get more synovial fluid, it becomes better. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. That's 1, 12. So much better. Listen, whatever is going on with you right now, the next month, the next 3 months, it's going to happen no matter what. You might as well go for what you want in life. I want to be guess I get an extra 30 seconds. I want to be around 215 or lower. I think the lowest I ever saw myself in a while was 210. But I want to be 215 or lower. And I'm giving myself till my birthday. So that's over 8 months, close to 9 months. So let's get it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I got 12s. All right, 12 to 2 like 3, 4, 5, 12's definitely too light. Five, 6, 7, 8, 9, 10, 11, last one, 12. Let's go. Seven, 8, 9, 10, 11, 12. Man. I think tomorrow I'm gonna do a leg day in the morning in like 12 hours. One, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12. Oh, I need to do 25s. Let's go. Oh man, I appreciate that. God will bless you also. Merry Christmas. Happy New Year. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Last one. 12. My goodness. Oh man. I didn't want y'all to see that because I was embarrassed. Hope you guys are having a good evening. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Last one. One, 2, 3, 4, 5, 6, 7, 8, 10, 11. Last one. 12. Oh, goodness. Oh. Last one. I'm not sure how long this water's been here. God. Think I got it. Think I got it. Oh man. Oh man. This is the last one. Thank God. Oh. Six. One, two, three, four, five, six, seven. That was painful. One, two, three. One, two, four, two, five, six. Oh, that was painful. Tempo. 5. 1, 2, 3, 4. Last one. 5. 1, 2, 3, 1. 4 and 4. Four. Three, two, 1. 1, 2, 3. 1, 1, 2, 3. Down, up, 2, 3, up. 8 counts down, 8 counts up. Eight, 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4. Come on. This number plus for 8. 8, 7, 6, 5, 4, 3, 2, 1. Now 8, 7, 6, 5, 4, 3, 2, 1. The most important thing, I always say this, most important thing, other than stretching, all that good stuff, is putting up your weights. If you don't put it up now, you make a mess later on. You make another mess later on, and then you gotta answer to your spouse. So when you're done working out, put your weights up. Ugh. So I've never done this part before, but because I have time, what I'm gonna do is, of course, after I put this weights up and make sure everything looks good, give a little bit of a 5-minute talk on just the simple things that I know, and then leave room for any type of Q&A. So, all right. So it's a little bit about who I am, Q&A time. If you guys got any questions regarding your heart, health, prevention, all that good stuff, let me know in the comments and I'll do my best to answer. But if you don't, I'm only going to be on for a little bit of time. So give me about, there we go. All right. Here we go. So, what's going on, guys? My name is Dr. Visang. I'm a cardiologist, and I use this platform to be able to discuss things regarding heart health and prevention. So, I talk about this a lot because, prevention is the best thing that we can do when it comes to heart disease. If you guys don't know yet, heart disease is the leading cause of death in the United States of America and likely worldwide. And the risk factors for heart disease includes things like hypertension or high blood pressure, diabetes, high cholesterol, strong family history, excess consumption, overeating, obesity, sleep apnea, smoking, genetics. But I think one of the biggest things is just not following up with your medical providers. So if you want to prevent a heart attack, you got to look at the risk factors. Because by the time people usually come to me, they've already had a heart attack, so it's not about preventing it anymore. It's about preventing another heart attack, but also about preventing things like heart failure. It's about preventing repeat hospitalizations. It's about putting you on medications to decrease hospitalizations. But also with all of that, there's going to be an increased cost of living with it. There's going to be an increased amount of expenses utilized on medical treatments, medical care, hospitalizations, and medications. So if we can treat it before it becomes an issue, is the biggest thing that we can do. It's the best thing that we can do as physicians. So I allow this platform to be able to, discuss those things and leave room for any questions. Unfortunately, on YouTube, not many people ask me questions yet, but I know my platform is pretty small for the time being. So when it gets bigger, I know more people will be willing to ask questions. But I mean, this is your opportunity to be able to ask questions as much as possible, so I can do what I can to help answer it. So when it comes to heart disease, one of the biggest risk factors includes hypertension. So that's what I'm going to talk about. I'm going to talk about hypertension, and you guys can go about the rest of your days, enjoy the time with your family. So hypertension or high blood pressure, what exactly does that mean? So a normal blood pressure is going to be 120/80 or less. And of course, if it's less than 100, it's going to lead to a lot of episodes of lightheadedness and dizziness. If you are, a certain weight and size. I've had a lot of young individuals, not young and small individuals who have blood pressures in the 90s and they're completely fine, but they weigh like 90 pounds, 90 to 110 pounds, extremely small, tiny, 5 feet or less. But ideally, your blood pressure should be around 120/80. Between 120 and 129 is considered prehypertension. 130 to 140, stage 1, 140 and above, stage 2. And people are like, oh my goodness, blood pressure the guidelines keep on changing. It was in the 160s before. Well, a lot of people had strokes. The SPRINT trial was created in the mid-2010s that showed that people who had high blood pressures in the 140s or above had increased risk of stroke, heart disease, heart failure, hospitalizations. Of course, the ones who were more strict about controlling blood pressures had less of those events, but also had issues with lightheadedness and dizziness. So you have to, in addition to treating a number, you treat the patient. My glasses keep on fogging. You treat the patient. So if I have an individual who's in their 80s, 90s, I'm not going to be as strict as their blood pressure, on their blood pressure. Granted, they're not having any issues, no stroke-like symptoms, mini strokes, TIAs. But if someone is in their 40s, 50s, and they've had, family history of heart disease, I want to attack that blood pressure, or at least I want their PCP to be cognizant of it, because that itself is a risk factor for heart disease, for strokes, heart attacks. So 120s to 130s, lifestyle changes with weight loss, nutrition, working out, nutrition, salt content, managing your salt input, and you give it about 3 to 6 months with lifestyle changes. If it's not working with just lifestyle changes, then we have to look at medications, but also have to look at other risk factors that could be making the blood pressure difficult to treat. Things like sleep apnea, things like obesity, strong family history could be one. Issues with the thyroid, issues with hormones, issues with menopause, perimenopause, all of those play a huge factor. So we do tests, do labs to make sure that there isn't any other contributing factors. One of the biggest ways to treat it naturally is going to be controlling your salt intake. So a lot of people who eat a lot of processed foods, asking them to make their own foods or decrease the amount of times they consume processed foods, and then rechecking their blood pressure. If it's not worked with that, or if the blood pressure is consistently in the 140s, 150s, then we have to utilize medications for it. Medications work well, but they do have side effects associated with it, so you have to look at the side effect profile. If someone has leg swelling, you don't want to choose one that may potentially have leg swelling. If someone has issues with your kidneys, you may want to hold off on the ones that can sometimes make the kidney numbers worse. If someone has issues with their potassium, whether it's too high, you may want to hold off on one. Whether it's too low, hold off on another one. So they all work well, but you have to look at the side effect profile of it and follow up on a routinely basis. My name is Dr. Isang, and I utilize this platform to be able to discuss things regarding heart, health, and prevention. I'm going to allow for 1 or 2 questions, and then I'm going to head off. Turn up, Jacob. 47 years old, 100% blockage, LAD, triple blockage, hospital 7 weeks, survived. Why don't I have any complications? EF is 35, and now it was F, now it was 8. That's a really good one. A lot of people I've met, not that many actually, that have EF that low and don't have any complications of it. Means that you're watching what you're eating is going to be the biggest one. Watching your salt intake, watching how much you weigh, because sometimes when the EF is that low, the heart's not pumping as strong as it should, so sometimes fluid can back up. So that was important for us to watch our weight, and if you're starting to gain more than 3 pounds in 1 day, 5 pounds in 2 days, then you can take an extra water pill to help expel that excess fluid. The answer, not 100% sure why some people with low EFs do better than other people. It could be, number 1, compliance with medications, and number 2, just you may have been healthy your whole life, and now you've had something that led to that blockage, but that lifestyle you've lived the past decades is now showing, and you're able to recover really, really well. I had a patient similar that was extremely active, marathons, and then had an unfortunate event. EF similar to yours, but still doing well on medical therapies, doing extremely well actually. So medication adherence is going to be the biggest one, and watching for any signs of volume overload or fluid overload. That's about it. If you guys have any other questions, let me know in the comments. Shoot me a message, and I am out. Dr. Isang. You guys be blessed. Merry Christmas.